Thank you everyone for coming to the OTAC Clinical Case Webinar. Tonight's topic is Music Festival Harm Reduction and Drug Checking in New South Wales. Tonight we have Dr. Thanjira coming to present, and she has a lot of experience at music festivals in New South Wales, along with experience in toxicology and drug health, and holds a role in the Center for Alcohol and Other Drugs at the Ministry of Health. I'd like to begin by acknowledging the traditional custodians of the lands on which we meet and recognize their continuing connection to land, water, and culture. So these are some of the registrations for tonight. We do have 9 interstate people, which is quite interesting to see, especially since this is New South Wales focused. So it's great to see interest from other states, and along with people from metropolitan and regional areas. And these are some of the roles for tonight. Many general practitioners and pharmacists as usual, but also people in every role. So that's really great to see. Just a little bit about the clinical case webinars. They are monthly webinars that we hold on Tuesday nights. These are recorded and available on the OTAC website. So if you do unmute yourselves to ask questions, please keep that in mind. And also we will send out certificates at the end of the webinar tomorrow. So you can use that to claim CPD points. And yes, the webinar will be available on the OTAC website. I just wanted to make a little note that there are OTAC scholarships. They just opened for this round. So the scholarships are open to unaccredited GPs and nurse practitioners in regional, rural, and metropolitan private work settings. And you can get up to $2,000 based on the completion of the OTAC and placement along with the accreditation. And just some quick housekeeping before we jump into the webinar. Please keep yourselves on mute unless you're asking a question. Thanjira is happy to have questions after each case. Otherwise, you can put them in the chat, and we have Dr. Sharon Reed here with us who will monitor the chat and ask questions at the end of the session as well. When you speak, please introduce yourselves, and also just keep in mind that the webinars are recorded. So don't reveal any identifying information, and please be polite. So now I'll turn it over to Thanjira. Thank you.
So yes, thank you for the program to invite me to talk. I always enjoy this webinar, so it's honored to be a part of this. And thank you everyone to come to join live with us. It's very nice to have all of you here. So before I begin, I would like to acknowledge the traditional custodian of the land that we are working and we are living. I joined from the Camaragal lands of the Gadigal people of the Eora Nations, was Aboriginal and will always be Aboriginal land. So I acknowledge, pay my respect to the elder past and present, and I acknowledge all colleagues and friends who are Aboriginal and Torres Strait Islander today. And also in the field of music festival, it's the effort of the whole society. So it's the community, also health, government, industry effort. So I would like to acknowledge hard work of everyone, including you in this call as well. You are here because you are care so much and you are a part of that. And especially, I would like to especially acknowledge people with living experience. I've been working in this area in New South Wales for 6 years. I've learned so much from peer and people who have a living and live experience, both in the music festival and in the clinic. You know, we read textbook, but the intelligence and everything that everyone share with us is actually shape our practice, my practice as well. And we love what we are doing here because of them. Not everyone get to go home when we talk about music festival. So I will present to you some of the information that we have in New South Wales. So this talk and our work also dedicate for those who didn't have a chance to come home, but their life have been contribute to what we have here for harm reduction at the music festival, and also contribute to other area of alcohol and other drugs harm reduction as well. So the learning objective today, I'll talk about New South Wales legislation, regulation guideline about music festival. I know there's a lot of, there's many friends from other states here. So I think the common principle is the same. And I also work with other colleagues in other states as well. So I think that will also be useful for you as well. I will also talk about harm reduction measures at music festival, some common presentation at music festivals, and be familiar with how we do drug surveillance. So the outline of my talk would be, at the beginning, I will give a bit of the landscape information on a music festival. I have 3 cases here that will go through, and then we'll also have a summary and can ask questions. I'm happy to be interrupted. So maybe I'll ask at the end of each case, but if it's burning, please feel free to interrupt. So let's go into the first part. So the peak body of the music festival is the Australian Association. There's a survey as, sorry, I'll just try to put my other screen up. So there's survey into 2023, because of after COVID, there's a lot of impact on music festival, as we know. So there's a survey of the members of the AFA. Be mindful that not all music festival organizers are members. So the number here that we see is actually underreported, or the real number would be more. So within a year, there were over 500 music festivals, and 75% of them is actually new in the last 13 years. And 10% actually have been around for a long time, 30 years. And about a quarter generates is electric music festival, and a lot of them would be in the city. And you can see the cost of music festivals around $4 million per music festival. So that's huge. So this report is actually publicly available. If you just search sound check, or then it will come up. It's a beautiful report and give a lot of insights about music festivals. So highly recommend. In terms of music festival, you know, a lot of people come together. So this is a mass gathering when we look at public safety. So the approach to do harm reduction would be that people have to communicate, use the existing framework, such as emergency preparedness, public health intervention, and communication. So for example, there will be infectious disease. For example, sometimes we also deal with JE, Japanese encephalitis, or sometimes also have to be prepared for snake bites if there's some water in the festival as well. So that principle applies. So the WHO has guidelines for mass gathering. So if you are going to work in this field, that is a very good document to go through. As I mentioned, that in New South Wales, we are very unique in terms of comprehensive regulation about music festivals. That's because in 2017 to 19, that seasons, we sadly have 6 young people die at the festival or after they attend the festival. That's very sad. And their postmortem samples indicate that MDMA was the main drugs of concern. There's others as well, but MDMA was the main. And there's coroner inquiry. This is also open documents that detail what happened and also reflection of the harm reduction back then. So one thing we learned from that inquiry is that those 6 young people have shared key features that they expose that contribute to the high-risk factors that contribute to the determination of music festival. That include electric dance festival, so that high-energy electric dance. These people actually have well connection with family. They are educated. They're not people who actually come to the clinic have problem of dependence. They are actually one of students or one of the university people. No evidence of addiction. They don't know if the toxicity is that bad. They think they just try and then it's going to get better. And that's during hot weather. And they dance a lot, as you can see, it's electric dance. And they have symptomatic hypothermia, seizure, and cardiac arrest. And the other finding is that at the festival that time is actually there's no adequate medical capacity. So that lead into New South Wales approach to have regulation. So after the inquiries, there's Music Festival Act that indicate that event organizers in New South Wales need to provide safe environment. And there's regulation that they have to for music festival organizers indicate what need to be provided. For example, what's the requirement of the medical capacity? What's the requirement of peer? What's the requirement of water, for example? And then also there's pre-hospital guideline to help doctors who might not be able to, might not have much experience in this field, so that can follow. The most important one, and also just recently updated, is the guideline for illicit substance-induced hypothermia. So that's the background. Let's come to the first question. So not all music festivals actually, not all event is music festival. The first one is, what's the minimum number of attendees for an event to be classified as music festival? You can guess 1,000, 2,000, 3,000, and 4,000. And this is according to the Act. You know, the size of the festival is actually various. It can be very small, it can be very, very big. That's great. So 63% say 1,000, that's good guess. The 16% 2,000. So actually the right answer is, oops. So yes, 2,000 is the minimum number of patrons to be classified as music festival. So this is the definition. In order to be music festival, it has to meet all the criteria. One is that it has to be music focused. If it's vocal, like one singer sing all the time, or that's not music festival. You need to focus on music or dance. And there need to be a series of artists. It used to be identified as 4, but now we remove the number 4. It can be series. And it has to have a defined area. You know, if it's in the middle of the field and with no fence, then that's not music festival. And the number is 2,000 and it need to be ticketed. So you need to pay for that. So there's a lot of people actually need to be involved in music festival, including health. For example, Ministry of Health need to get the plan for the festivals before the festival can be held. The organizers need to submit the medical plan of how many doctors will be there, how many equipments, ventilators, all that need to be submitted to the Ministry of Health. Ambulance as well, ambulance will be deployed at the festivals. There's disaster, state HAZFAC disaster, local health district also need to be informed because there's a chance that more patients will be transferred to that hospital. Drug and alcohol, some of the festival, we also notify drug and alcohol as well, especially if there's drug checkings happening. Hospitals, obviously, poison center. Also regulatory, you guys, the agencies that exercise the act and have compliance check, go and check alcohol compliance, for example. And industries, also organizers who get the music or the festival to organize, the promoters just to do the stage and everything. So, and also peer as well. So there's a lot of people involved once it becomes music festival. So let's go to the case. So the first case, I have an 18 years old, and she's have diabetes. She's on insulin. She's also have EpiPen, and her insulin is the rapid insulin, so she needs to inject 3 times a day. And she also carry EpiPen and also naloxone. She might be the user, or she might just carry, because nowadays stimulant users or people who don't use, we actually also encourage people to carry naloxone for precautionary and help people as well. So she's attending the first festivals, and she would like to know if she can carry her medications into the festivals. What is your advice? Yes, no, I'm not sure.
So yes.
I hope you can just guess. There's no right or wrong answer. I hope it's not too complicated either. And this is very common, actually. Common questions. And also we have patients too. A number of patients actually present to the medical center because of their underlying disease. So I intentionally use medications that are needles, that have needles. So it's a bit more tricky. Perfect. I love this. So yes, that's correct. And yes. So if we go to the guideline, it's clearly say in there that, we would like people to be able to access to the festivals and also can use their medication as well. So it's in the guideline for the event organizers to organize that. But in reality, it might be challenging. So people might feel like they would like to avoid carrying, but if it's necessary, then can be reassured, and you can tell your patient as well that they can carry. So it says clearly even insulin, and at the medical center within the festivals, there's also some fridge or some, SK that can keep insulin or medication that need to be kept as well. But in that case, it's good to call or to contact the organizers beforehand. What happened, and also when after use, the needles also have the safe disposal for that as well. So sometimes at the gate, well, they always search, like when people go to the festival, they search at the gate. And when it's a needle, sometimes it's a bit challenging. The rule is the medication need to be in the original package. And if the prescription, then need to be named, and it's the name of the person who carrying in. So there's always ID check. So that's not going to be a problem. If there's some problem, then the security will call the medical, and the doctors and the medical will verify and will make judgment on that. So then yes, they can carry in. So in the festivals, there's on-site medical capacity as well. In New South Wales is the regulation that the organizers need to provide medical capacity that is adequate for resuscitation, because we see MDMA toxicity and there's intubation required in some high-risk festival. So there will be doctors, there will be nurse, paramedics, and critical care level as well, and first aid. And equipment need to be tube, ventilators, and active cooling, ice, blanket, and sometimes there's the bag that people use to put people with hypothermia in the back, and that's another day, so not for today. But there's also need stockpile. Naloxone is always on the list for obvious reason, and other resuscitation medication. There's also ambulance. There's going to be ambulance vehicle at the festival. And some high-risk festivals, we also deploy the medical retrieval doctors and critical care to be ready to escort the patient who's intubated to the hospital as well. So it's going to be at the festival. There's PIA as well. So most of festivals in New South Wales will be, PIA will be delivered by Dance Wife, which is NUA. But some particular festivals, for example, Mardi Gras or something specific, then it will be other peers. ACON will do Mardi Gras, for example. There will be care space when people use and then have a trip, then there will be peer and sit the trip with them as well. There's education. There's also other things, sunscreen, earplug, and blanket. So the weekend before, not this weekend, there's festival at Sydney Showground. It was so cold. So majority of people who came to the care space actually feel cold. So blanket and some chill is actually helpful. Drinking water is really important. So also depends on the size. If the festival is really big, we also need to check how many outlets of waters available. And during summer, the water needs to be chilled as well. Imagine it's so hot and then you drink water from the pipe, it's actually warm water. So they also have to make it cool water. In New South Wales, we have campaign that is communication that we say stay okay is actually my gowns also stay okay, because I normally wear these gowns to the festival. There's some message that's actually consulted with young people and peer how to do messaging and basically to help people to get help early and to feel like they are not judged. So, yes.
Can I interrupt?
Sure, it's a time for question.
I just comments on the chat. Joel Hillman said, in response to some of your earlier slides, my understanding in New South Wales, patients may possess any drug prescribed in their name, providing the pharmacist's label is attached and legible.
Thank you so much. That's really helpful, and that's my understanding as well.
Yeah, although Joel also notes that unfortunately the police are not usually across the law.
That's another conversation, but if it's a prescribed medication, then at the gate, it's actually the security need to check with the medical. So medicals will get called. And it's also important that patients should know, patrons should know their right as well. So as a provider and, you know, people, we care for the patient, we can tell the patient that if it's prescription, you can take it in, but need to be in the original and name. And then if there's some problem, then, you know, verify and the security can call the doctors, and that won't be a problem. But you know, if it's methadone, you know, you don't need to take at the festival, just take it before. If something like that, that's not gonna get in. I mean, if it's takeaway, just take it beforehand. So that makes sense. Any more questions?
That's it for now. Thank you.
Thank you. Okay, next, let's treat the patient. So this is a real case. Some of you might hear about the case already. That's quite in our drug warning. So there's 3 patients became ill after taking Red Bull pills at the festival. They thought it's MDMA. So the first patient we had, I was on call. I was on duty for this festival as well, and I got call about this case as well, or 3 cases actually. 25 years old female. She took a tablet, thought it's MDMA. It had Red Bull press on top. It's pink color. She came in coma, Glasgow coma scale 3 for some colleagues who might not be familiar. Blue lip cyanosis, no breathing. She came quite early. still have pulse, blood pressure 129/74, temperature 35.3. By the way, this is summer, January, late January, so it's not that cold. Oxygen saturation 55, room air, pinpoint pupils. So the question is, what's the likely diagnosis for this? If you can do the poll, please. Stimulant, serotonin toxicity, opioid, anticholinergic toxicity. So MDMA is quite common at the festivals that present to the medical center, and also at the drug checking as well. Thank you. That's yes. So 5% says stimulant. That's most common. Serotonin toxicities. That's also common. But for this case, it's opioid toxicity. It's not stimulant because most of the time that will be, agitation, tachycardia, and blood pressure will be going up more than this. Serotonin toxicity and stimulant come together a bit, but there's a bit more of the tremor part and motor part. So there's nothing here actually indicate that. But MDMAs normally cause stimulant and can cause serotonin toxicity. But in this case, it's opioid toxicity. Patients have pinpoint pupils, stop breathing, reduced respiration. And so that's opioid toxicity, not anticholinergic. Anticholinergic can cause people have CNS depression, but the blood pressure will go up a little bit, but not necessary, but more like they will have dry skin. If they're this coma, normally they don't go deep coma this quick. So hopefully that's clear. Thank you for the answer. So these 3 patients came in. So the first one came in, need naloxone 800 microgram. So that need twice, quite a lot, but not a heap lot. The second and the third case also came with the same presentation after taking Red Bull pill. Also have opioid toxicity. They both require naloxone as well. The 3 cases responsive to naloxone. They were transferred to the hospital because it's unexpected, and people can collapse, and that's quite strong. So what happened at the festival is that there's alert at the festival. There's something. There's some interrupt at the festival by communication. So all stakeholders has been informed that there's 3 patients unexpected toxicity come to the festival, alert by the senior doctors, which is the emergency medicine doctor specialist on site, like, oh, this is strange, this is what's happening. And also peer as well, ambulance, everyone's get alert. And then there's a meeting and coordinate with us at the ministry as well as the poison center that this is high risk and there's potential a lot more people. And remember, we have naloxone, but we have limited amount of naloxone where we can treat maybe 20, 30 people. What about if it's 100? Because it's still available in the festival. That time people purchase. So what happened is that the artists stopped music, the DJs and the organizers announced about what happened, and also warn people that, people's already sick at the festivals, and also MDMA, this is the feature, they should look after yourself and also come to the medical or peer. So after that, actually a lot of people came to the peer and medicals, discard the tablets, and also we analyze the tablets as well. You can probably see earlier about the Red Bull pill warning, that's from last year. So that's high dose, and it turns out to contain nitazine. So that's very strong opioid, and that's why it's just a little bit then people who have opioid toxicity. Also, we also did media release as well. So opioid overdose after using stimulant is prevalent. So we've started to see it earlier, actually since 2021, we've seen sporadically. So this paper is actually free access. We just published a couple months ago. Please feel free to search. So that's figure that we search from the PRICE data. PRICE is the Prescription Recreational and Illicit Substance Evaluation Program in New South Wales. We analyze patient sample that present to emergency department, or also some alcohol and clinic as well as the festival. So we had 34 cases during the time that we analyzed since 22 January to June 24. So that's 18 months, 34 cases. Cocaine and methamphetamine. People think they use cocaine. They actually have heroin in there. And they have methamphetamine, also have heroin in there. So these are all confirmed cases. There's many more. Last week, I still get notification and we still analyze those. So it's common, not very common, but it's prevalent. And initially, there's only New South Wales that saw this, but now we see in other states as well. If you see the alert from other states, they start to see that, and also in other countries as well. The other thing is about, I mentioned nitazene in Red Bull pill. Nitazenes, we also have a paper just recently released. This is also open access, so please feel free to search. But this is analyzed and look at IDAU is the police seizure data. This is the samples that's sent to the lab to analyze. PRICE data is the clinical sample. And coronial toxicity, we also get toxicology result from the coroner as well. So we start to see fentanyl analog, early years 2021, we start 2021 because that's when we try to formalize the surveillance after the music festival days, as you can see. Then we have more information. Early years, we see more fentanyl analog. But since 2022, it's actually nitazenes is more prevalent. What's nitazene? You might hear a lot more by now, and it's probably not a focus on this webinar, or there's other webinars already talk about it. But basically, it's synthetic. It came during COVID, and also Afghanistan. That the poppies has not been grown a lot, so the drug markets shift into something synthetic, and what they normally do is to go through anything that has not made pharmaceutical commercial in pharmaceutical area, because there's some pharmacology information available. So this nitazenes has been produced since 1950s. It's not made to as a drugs because it's too potent. Then it's come back into the drug market. It's the problem now. It's a really big problem, as it's very potent. There's many of them. We've seen them since 2022. Okay, so is there any questions? I hope that's not too fast.
No, that's good. There's
Okay.
no more questions. Thank you.
Thank you. Okay, now let's go to the fun part. So as you know, and also other states also have as well, we have drug checking. In New South Wales, it's the 12 months trial for 12 festivals. We've already complete 3. So drug checking in New South Wales available in some festivals, and we choose festivals as if the organizers willing to do it, and also have a bit of high risk as well. So we have this patient, 20 years old man. He bought 2 MDMA in the festivals. He took 1 tablet. He felt it's quite strong. It's very strong. So then before he used the second tablet, he's thinking about going to the drug checking service at that festival because he knows it's available. So my question is that, can the technology, because he wants to know about the dose, is quite strong, right? So if the technology is used at the drug checking can report purity of the dose of the tablet, is it worth going? Likely, unlikely, or don't know? I feel my question is very easy. But it's 6 to 7, right? Between after hours and cooking. So shouldn't be too complex.
While we wait for the answers, there was a question in the chat. There's a pharmacist asking something not specific case related, but the question is, has anyone started selling or distributed drug sample test kits for their patients or customers instead of waiting until they get to the festival? Are there guidelines on this?
Mm. So I'm not selling, so that's probably something that people can contribute in the chat. I'm not sure about the guidelines, so, but I know that some peer also have like peer service, have strip online that people can purchase.
That's interesting. So we don't know whether they've
Yes.
been, how well evaluated they've been. So Joel,
You mean the validation, right? So it depends on what we are talking about. So kit normally is immunoassays. So it has to look at each specific one and compare with the gold standard. So we actually at the drug checking, which I'm gonna have slide, we have nitazene and fentanyl test strip at the drug checking, and all of the drug the samples that people brought in for checking, we also have the confirmed test. We bring the sample back to the lab and do confirmed tests. So we also validate the test as well. The information is not available right now about the validity, but that will be information to share. Thank you so much. That's great answers actually. 45% said likely, 50 unlikely, 5 don't know. I think this is everyone's actually have a correct answer because, well, I say likely because most of the time for MDMA we can do it, but all answers actually correct. I'll explain in a sec. So our drug checking plan for 12. So for the drug checkings is to reduce the risk and harm by giving people information and allow people to bring us small samples. We allow more than 1 samples per person, but most of the time people come as a group. And then intent for personal use. So this is not for the dealer, you know. And the service, actually, we have qualified staff, which is the forensic analytical science service analyst, who's actually analyzed the seed sample. So they're very experienced at the drug checking that we use. And test for the main component, I'll explain that too, that the equipment that we use at the drug checking is not a confirmed test. You know, it's not GC mass spec or LC mass spec because otherwise need extraction. And for the nature of the festival, you know, people pay a whole lot to come to the festival. People want to attend music. They don't want to be there for half an hour waiting for the confirmed result. And also most of the time, the equipment is actually very good. So the potency, we can do that as well. And then after getting the result, the peers will talk to the service user who come and then talk about what's the result and give the harm reduction intervention. I sit with them as well, and when it's high risk, I also do intervention as well. So then the service users will make decision. We can't take the samples, like they come and test and then have to return to them. And then the trial will be evaluated. So here's what's the journey. People come in to the service. Peer will greet them, welcome, and check their eligibility. What this mean? If they're intoxicated or very sick, then we send to medical, you know. And the waiver form just to explain what the technology is, and we'll take a bit of the sample to test and then proceed for testing. and I'll have picture, and then have the result, interpret the result, and then give harm reduction intervention. And finally, the service user will decide what they're going to do with the drug. So when people come in with the samples, it will be photographed. We're going to have all the very high quality photographs for, for the database, as well as if we need to put the alert, we have really good photos, right? And then it will be given the identification number. We don't take the name of the person. It's all very confidential. Then weigh the samples and then scrape some of the sample, as you can see, use very small portion to test, and the rest return to the person. Then use the technology. All samples will be tested by 2 technologies. First is micronear. Second is the FTIR. They are all infrared. It's like we call magic torch for that, magic torch. How it works is that, use the light. I hope you can see. Use the light like that, flash on the samples, and then measure how much light actually absorbed by the samples and how much reflect, and also use the pattern of reflection. So all the pattern of the molecule will be detected and will go up to the cloud and to determine what's the sample it is. So that's how the micronear and FTIR work. Micronear is the near infrared, is the wavelength of the light, and the crystal and the whatever reflection that pass through. So you can see the mobile phone, and that's, it will run some seconds and then it will come as what's the detection with the purity as well. FTIR, it gives more length. The length is infrared, so it's wider than micronear, but FTIR wouldn't give purity. That's why we use 2. And some of them won't detect, or if there's some suspicious, it could be nitazene or it could be opioid. We can also use nitazene test strip or fentanyl test strip. Some people think about fentanyl because they listen a lot of Canadian and the US podcasts and things. So people are curious about that. We can also use color spot tests. It will give categories, for example, LSD or some type of others that might not be detected. Then we can also use the database as well. Some analysts, when they see the tablet, this is always 20% of MDMA. They've seen hundreds of times, for example. Okay.
Thanjira, can I just interrupt? There's just a few points in the chat from particularly the pharmacists that are on part of the audience.
I love that, please.
Yeah. And a bit of discussion about the testing kits for, and they're wondering whether anyone started selling them yet in their pharmacy. But there is comment that they're of mixed reliability and they lack evidence of implementation. And someone also said that often these kits are quite commonly sold in pharmacies in Newtown, for example. Mahal says, I was working at a festival earlier this year and some patrons bought some under the table drug kits for free distribution.
Yeah, it's very good for us. I mean, we use some of the nitazene test strip, and it's actually quite good. But I can't say for sure what's the availability. And also, for the test, you want the pre-test probability to make it, the validity is better. So also, it seems to be widely available, but sometimes it's also takes a few months to order as well. So I think one kit I was told like about $10, but that's not a problem. We don't use every samples for the other reasons. If each test that we do, FTIR and microneas are non-destructive. That means you can use and then you don't eat the sample. For the test strip and the color test, actually have to scrape more. If people don't worry, they don't want to test. Like sometimes we offer, oh, would you like to test nitazine? No, I don't worry. Want to keep the sample. So that's one very common factors that people actually don't want to test. And then, you know, after getting the result, then inform the result. You can see iPad here. We actually enter the data, even like how many people have been in the service, harm reduction service before. For that 2/3, actually, this is the first time. And there's amnesty bin there. You can see people can choose to throw their samples. There's naloxone given at the service as well. Quite good uptake. The weekends before is actually half of people, 50% of people actually would like to keep naloxone. We have the theme, it's the hero thing. It's not about you, it's about your mate and other people. You have it, you see someone collapse, you use it. So it's for free as well. And we have credentialed staff that can do training. It's like what you distribute in the pharmacies and at the service as well. So we also do have that as well. So the risk assessment I mentioned about when we get the results, we determine if the result risky. You might wonder when we release the public drug warning, when we don't. So that's a risk assessment matrix that we have in New South Wales, that we have the expert panel, and our expert panels are multidisciplinary, including peers as well. We have community representative in our expert panel. It depends on the type, the strength, combination, like stimulant, like nitazine in stimulant, definitely is gonna go as the alert. Unexpected result, some harms, also communicate with the medical as well. So sometimes I run in and out the medicals, or we have this very high dose tablet. Do they see patients? And also like how many more did they buy in the festival? How many tablets around? Something like that. And do assessment. And if it's gonna go out as the warning or stop the music, then we work with the stakeholder. And also everything feed into our surveillance. So this is from last month, after one of the drug checking service that we did. We got 5 tablets that issue the alert. So if you search New South Wales Health drug warning, it's going to come up for the whole last 5 years. So this is also, you can see Red Bull pill, right? So it's the same Red Bull pill with what we have with the patient, just the other questions. We also see it's back to the drug checking. It's quite high dose. So this one is 220 free base. Free base means no salt. If add the salt, then free base is with the salt will be another 15%. So that's high dose. And so far, I see 5 minutes left, so I'll be quick. So far, we had 3 festivals done. So majority is the top 3 that people brought in MDMA, ketamine, cocaine. Just for your information, the patients that sick at the festival that transfer to the hospitals, these 3 are also the top 3 detection as well. NPS we detect at the drug checkings 2CB. It's expected. People brought in, I think it's 2CB, and it's turned out to be 2CB. So that's not unexpected. Around 11% of all the samples that we've done 3 festivals were unexpected, and a number of people discard that. And from door to door, people like to know how long it takes to go from talk to the peer, at the beginning, explain technology, do analysis. People love to watch when the analysis is done, and we allow people to watch and ask questions as well. So that's very fun part. And then also get the interaction, get naloxones, that 15 minutes, not too bad. I mean, not long. So these are all public documents. So in New South Wales, we have the price program, which is the clinical sample we test. We also have Cosmos, which is the combined surveillance and monitoring seed samples. This is police seizure at the festival. We'll bring back to the lab. We also get information as well. And the drug checkings also feed into our database in the Ministry of Health. And not only that, we also have information from peer, other documents as well as intel that we get shared, also interstate as well. For colleagues from other states, we actually talk to your people as we share information for public safety. Also have ambulance data, poison center data, police data, as well as international data, MSIC, NSP as well. So we all share information. So in summary, in New South Wales, our music festivals have regulation, have legislative framework, but it's all very wide collaboration between all agencies. Opioid toxicity, I know this is opioid treatment program, is not very common, but with opioid in stimulant and also actually multi-day festivals, that's where we see heroin and other opioid toxicity because people's there for many days, so people actually use their usual drugs as well. So we emphasize on harm reduction, and we recently have drug checking that add into the harm reduction and all information that feed into our surveillance program and early warning. We have the teller and the triage system that also consult with all stakeholders and peer as well to when to alert the public. So we would love to hear from you. I'll stop there. There's a few more minutes left for any questions. This 1 hour go very quickly.
Perfect timing, Thanjira. Thank you. We did have one question in the chat from Cece asking which other festivals are part of the trial.
So in order to come to the trial, there's depends on the interest of the event organizers. At this point, we don't have the next confirmed one as the tail of the festival season has come to the end, but we have a number of high-risk festivals coming up. So I can't tell you right now what's the next one, but there's in New South Wales we have quite a few high-risk one, and we expect those will come. We will have drug checking there. So just the rubrics of how things work. So prioritize the festivals that have medical presentation, have high risk, and have a big number, and have a lot of more drugs related harm in the past. And also it's the agreement of the organizers to accept the drug checking, because whenever there's drug checking at the festival, there's going to be media interest and there's going to be a lot of logistics to go through. So not all festivals organizers are ready for that. So we work with all the organizers and all stakeholders to make it happen. But I think 12, that will be enough 12. Thank you for the questions. And I normally go to all of them. I normally go to the festival as well as the medical before the drug checking. And the drug checking, I play the part of clinical lead. So I'll be there to look at the results and also deal with any clinical questions and work with the stakeholder. And then at the end, also go to medical as well. I do the medical as well. Normally I read the plan and approve the plan. So we all work together for 5 years now. So it's very rewarding space to work and very fun as well. And I also want to end as going to the festivals actually can change our perspective. People talk about drug, people talk about harm. Actually, there is the happy place for young people to be together. When you see them smile, being a part of the community dance, helping each other. Like last festival, I got the hair clip, the heart and things, they're all very friendly, and also economy as well. It's, jobs and people help each other is so beautiful.